sana tunaweza. Thank you Maibo DG. Thank you very much. Yes, when I chose the deputy governor, I chose peace. I chose support. And I chose to be a man who will always be supported every day with a prayer before we start our daily work. Mheshimiwa Adan Duale Bare ambaye pia ni CS kwa medical services katika nchi ya TharakaNithi. Nimesema mheshimiwa, ukiona mtu ameandikwa honorable hapo ni kumaanisha amekanyanga bunge. He used to be a leader majority and I have a history behind me at Duale. When I became member of parliament, niliambiwa usipoona Duale hutapata committee mzuri. And I look for Duale. He was very evasive, but we eventually had a cup of tea, and that is why I was in very great committees in the National Assembly. Through hopes to the CS of health. At that time it was not Duale. Ikakuja wapili. The letter is still not implemented. Sasa tuko ya tatu. The letter is not still implemented. And there is no way the bulldozer will not be able to implement the directive of the president. So I am sure the county government of TharakaNithi, we cannot go to bother the president with those small things. He already wrote his letter, na ilikuwa issue mbili. Ilikuwa hiyo ya 100 support to this hospital for equipping, and then take over the building we are done for the KMTC, which is halfway for KMTC to complete, so that the KMTC on a CS, which is now at Chuka University, can move here. The MP amefanya kazi mzuri, amejenga tuition block na ingine hapo nafikiri library. Sasa tukipata hii ingine ya classes, KMTC unahamia hapa, so that we can continue giving them space to practice without having to use a bus all the way to Chuka University. Having said that we've opened the ICU today, allow me in the same breath to say that in 2017 we had 64 facilities when I took over as the governor of TharakaNithi County. Today, and up to today, we had 118, or we have 118 facilities in TharakaNithi, up from 64. But allow me to say today, the Honorable CS of Medical Services, Adan Duale, has officially opened the 119 special facility in TharakaNithi County, which is the private wing of Chuka Hospital, popularly known as the amenity ward. The amenity because it's not exactly private. It's only that we will give you private treatment when you come here. So those who have been going out, Bwana County Commissioner, your chiefs, wale wanaenda hizi hospitali ziko na majina spices hapa, before they go there, let them check ours could even be better. Nimetoa Bwana Duale hapa na ameniambia yeye akipata shida area hii asipelekwe pale nyingine, apelekwe wapi? Iko kitanda yake hapo, iko TV, iko pali yake ya ku refresh hapo, na iko personal service katika hiyo amenity. And we have requested you an office, Bwana CS, that you allow us to register that facility as a standalone facility in TharakaNithi County, so that when we are claiming SHA for the services, it is not Chuka Hospital and it is not level 3 that you gave us here, but it is going to be a standalone facility for that matter. And allow me to thank you, because working together with the Department of Medical Services, Minister of Health, we have been able to resource TharakaNithi County with specialists who have not been there before. Most of the times we make requests. Dr. Nduraku knows that I send them to ministry. He initially used to see Dr. Kyoko, but I think we have somebody else now to hunt for us disciplined specialists who can be able to work for us in TharakaNithi. And also we have been able to take very meaningful training out there so that they can come back and continue serving our people. Through that program, we have been able to increase the number of pediatricians, physicians, surgeons, obstetricians, ophthalmologists, anesthesiologists, and critical care specialists. What we are lacking at the moment, Wana CS, and we are asking you, because when I see you here, I see Dr. Oluga here, I see DHA and Mercy. There is no way the four of you can put your heads together and you fail to identify. We are not asking you to pay them. We have advertised, but you know, these doctors like working near Nairobi, Thika, Kiambu, so they can continue practicing in Aga Khan. And we are telling them we're going to pay better than Aga Khan. And in Chuka, hii area ya Chuka pia iko na pahali hapa pale unaweza fanya practice ama na pale after working hours if you want to continue doing that. So tunakuomba ututafutie a radiologist and a pathologist. Those two are the ones we have not been able to attract. So wherever we want to do postmortem, we have to get from Meru, sometimes Embu, and also the radiologist we just lost the other day because she went on transfer when she lost the spouse, and we not been able to replace. Now we are just working remotely, and we ask you, because of the machines we have brought together with you here, they need a presence resident radiologist to be able to interpret the images. Dr. Mercy has correctly put that in every six people, the sixth one is a suspect. It's like she read our mind. Honorable CS, TharakaNithi has a statistics of an average from our records here of 462 new cases every year of cancer that are reported from all our facilities. 462 is a very big number. New ones every year. And therefore, you mentioned when you were having a brief meeting before you came here, that when you went to America, the American government said they'll support us directly this time, through the ministry and directly. We are praying to you as a legacy of your visit today. When you sit down to consider the counties you'll support with cancer centers, it doesn't matter the size. Please put a special consideration for TharakaNithi, so that the 462 cases do not become advanced cases and people lose their lives, because we have increased our effort in screening. The only problem is we don't have a cancer center that can enable us to train, to be able to treat. I also want to thank you, CS, because working with you and the Council of Governors, the placement program for the equipment, which is National Equipment Support Program. We already have two hospitals that are already supported with that in TharakaNithi, that is Chuka Hospital and Marimanti Hospital. We are on the way to doing the same for Magutuni. But the highest level of equipment we have here in this county is only the CT scan. If we an equipment that is called magnetic resonance imaging, that is MRI, we will have to go to another county. And we have very many clients we refer. We would request that we have the space, we have the technology in terms of the medical, the MOs that can be able to deal with that. Please, we would like to have MRI placed in one of our hospitals, if it's not two hospitals. I want to take this opportunity before I finish to thank the County Assembly of TharakaNithi. It was not a mean task or a mean feat what we had to TharakaNithi, convincing MCAs the 15 wards to continue putting money in one ward. Because it's not possible to have ICU at a level 5 in every ward. Katuro has been having a very big task. In fact, he was being accused every time because he's the chairman of budget when pesa Chuka. And he reached the point where he said, Chuka Hospital is not a hospital for Karigani ward. It is a hospital of everybody in TharakaNithi. But through the magnanimity of all these MCAs, the health chair on the leader of majority in leadership of the speaker, they walijifanya kichwa ngumu. They defunded the budget hata kama inapigana nayo, and today nobody in TharakaNithi needs to be referred to another level 5 outside unless they want to, because we have level 5 that is as good as level 5s in Nairobi and those are the neighboring counties, and today we have an ICU because of that good work that they have done. So thank you very much, Speaker. and the county assembly continue doing that good work. Sometimes the biggest and the toughest of things don't come from very good negotiations. Sometimes you even have to fight. People realize later that you're doing a good job. So I would like to thank them in the same breath. Our member of parliament already talked about KMTC. I don't have to repeat that. It is clear. But I would like to send you to His Excellency the President. Tell him that he should not listen to the noise that is happening around Mount Kenya. This mountain has very many sides. On this side of the mountain, we do not have any other route we are taking. We will not be following people blindly. We have no reason not to support the president for a second term. Completely, we have no reason. Because politics is not about love. It's not about mapenzi. It's about interest and benefits. If we are getting what he promised and we can see things are working out, we have no other reason not to support him. Just take our critics to him and tell him that you promised and delivered is 100 million and you'll continue finishing the MTC, and we are still waiting for him to come and open when it's complete so that we can be able to go to the next level. As I finish, the health workers of TharakaNithi, led by CHPs. CHP mupo? Hii jeshi yetu na wewe Bwana Duale, because you pay half, I pay half. Of course, I am the one who recruits, because from Nairobi you can't tell who is who. You might even end up paying people who have already been married in other counties and they're working for another place. Or some have left. So I keep watch here and send you a list. These are still at work and we continue paying them. I'm sure you know that TharakaNithi is one of those that we are not late by 2 months. Maximum. We are up to date. So starting with the CHPs, to the doctors, specialists in this county. Those people have worked very hard. I want to thank them. Led by Dr. Nduraku and Chief Officer Laws. It's good, important to know that Dr. Nduraku is a gyno. Ruth was the head of nursing before 2022. So in other words, I am also a very good follower of President Ruto. I give professionals, smart people, the space to work in the right places. We do not drag people who are campaigning with and they do not have the knowledge on how to deliver, occupying certain places. That is why some governors have a very difficult time. Because by the time they're campaigning, like these ones who are campaigning here, there are some people who are already telling them, I'm campaigning for you, but I'm the CC Health. That time you're talking to a guy who sells mahindi. And he's oiling the machinery for campaign. Ukimuleta hapa, unaenda nyumbani kesho yake. So it is better to give Dr. Nduraku who never campaign, Rose who never campaign, because they don't know how to campaign. They work for us, then us we get the benefits and we campaign with the president. So I'm a good follower and I want to thank them very much. However, we have a small problem. These Gen Z doctors we have nowadays, they are very ambitious. They want to have 3 jobs within 24 hours. They want a job for county government, they want a job in a clinic in town, and they want another job in Nairobi. I was hoping Davji would be here and invited him. Where is Davji? Davji, please. Can we clap for Davji? He said, Miss Keller, can you please clap for Miss Keller? We will organize you. They are very supportive nowadays. Those doctors have made our hospitals a retention, where they see patients here during the day, then they refer them to their clinics later in the evening. Not all of them, very few, like maybe out of maybe 36 doctors, about 3-4 of them. But you know, one apple, if it's rotten, it will affect the others. So now we can't touch them sometimes because the union is there. The others are saying there is solidarity. But please, we need to be reasonable. There's no way you can be working in Chuka Hospital where they have the best diagnostic machines, and then you take people to your clinic, then later refer them here for imaging, and then you take the results back to interpret. It's not right. Some of that money that you earn in that way is not a blessing. It will find its way in very many other different funny places. So make sure you give your employer, who is the resident of Kenya and TharakaNithi, fair treatment even before you go to your clinic. We may not have ever completely stopping you, although we are working on it because you've signed something called, you'll have non-practicing allowance, which we give you every time, so that you spend your 8 hours here, 12 hours here before you decide to go to your clinic. And I'm saying that because, CS, you are aware, most of the claims you're getting from this county that are funny, like probably 93% of births are Sicilian, they're not coming from public facilities. They're coming from some of these private facilities that are patronized by our patients, but operated by the same specialists we have employed in our facilities. Unapata kule amevaa kabuti imeandikwa TharakaNithi County, akienda pande ile nyingine amevaa kabuti imeandikwa hospitali nyingine. Same person, same sura. So we need to find a way of dealing with it. Na msiniangalie vibaya, the fact is that you are supposed to be the ambassadors that the facility is working. We can't put an ICU here, then put a special amenity ward, which is much better than even some of the privates. Then you take people from there and take them to another place. Utaendelea kunisaidia, wengine wakienda nyumbani nipatie wengine, kwa sababu we have no other way but just to deliver like this. Last three, and very last, CS, you had requested that the county governments and Katra is here take up some indigents. Indigents are those people who can't afford SHA because of their poverty level, or they are not blessed. They are blessed in a different way. Up to now, TharakaNithi has not taken over the issue of indigents, but I want to promise today, having consulted our people, that we'll start with a small team of 3,000 indigents in TharakaNithi County, which we have to appropriate that money in the supplementary budget for the speaker in January, so that we can pay for 3,000. It's not a mean feat. 3,000 indigents at your rate of 660 translates to 23,760,000 in a financial year. That is one bridge of the budget, or one road of the budget, or one village which is not getting some of those services we have gotten, so that we can benefit also our senior citizens who can be able to afford this. And I would like to end there by saying that the NPDSR that Katra talked about, which is inter-county, is a program that has been put together to monitor any maternal death that has taken place in any county, any unborn, or a child who has been born, or an infant who has been born and has died before leaving the hospital, out of negligence, out of a condition that has been avoided. And through your support, CS, the counties are doing very well, because these cases, when they are discussed in that forum, we normally have awareness. It is not a shaming platform. But when you tell us that a mother bled to death after giving birth, because your lab could not match the blood in time, because the guy in charge of the lab had gone for lunch, that is a curse. Because by the time you're taking that patient to theater, you should have checked the blood group of that patient and told the lab to prepare just in case. So they are dying because we are also careless. A mother died because the ambulance was not having fuel and the chief officer had not authorized in time, because it had gone to Kenyatta the previous day and it had come back empty. How can a mother die because the chief officer was not available to authorize for fuel? You know, those kind of things. Or the ambulance had not left the garage because the garage did not have a sign of the transport manager to release the ambulance. Yet we have cooperated, and I'm sure you've seen even the ambulances here from GK, meaning the government of Kenya also has given us ambulance. It is just in management. So we are saying, this festive season, please, our health workers, as we celebrate Christmas, make sure our mothers are also giving birth happily, because we have looked after them. Let's go an extra mile and make sure that we even provide special meals over Christmas in our hospitals, to make sure that our people also celebrate Christmas. Great societies are not measured by wealth alone, but by how they treat the vulnerable. And to do it, we proclaim that every life in TharakaNithi matters. Every life is valuable. Every life deserves protection. But let me emphasize that it is not the finish line that is important. It is the foundation. This is the beginning. We will continue to strengthen our health system by upgrading sub-county hospitals, enhancing maternal and child health, improving emergency response, ensuring that essential medicines are always available, and we will invest more in prevention, as and saying, as the saying goes, a stitch in time saves how many? 9. And to our healthcare workers, we have already said we are working very well. Doctors, nurses, clinical officers, pharmacists, laboratory team, and our support staff. You are the pillar of the hospitals. Machines may monitor life, like the ones we've seen there today. But it is you, the worker, who restores that life. Because that monitor there will monitor and say this patient has low blood pressure, the sugar level is high. It is you who will correct out the machine. May this new facility empower you to serve even better. To the people of TharakaNithi, we ask our people to utilize the facilities and serve the communities around, even beyond the boundaries. Let us not open an ICU and then we continue having a fleet, or rather many people getting out of here because of politics that are negative, or people who just make health a political agenda, and because it's not supporting the government of the president, they continue telling you that SHA is not working. Yet when we check in TharakaNithi, we are almost at 63%. Those are TharakaNithians, not outsiders. If SHA was not working, they would never register. Where there is unity, as I see the members of parliament here at the county assembly, is progress. Where there is courage, there is hope. Where there is dissemination, there is no limit. Let us protect what we have and build on what we already have existing. Let us value it, let us support it.